Live. Right. Good evening, everyone, and welcome to this meeting of the Adult Social Care, Health and Communities Overview and Scrutiny Committee on Monday, the 23rd of April, 2026. So you're all very welcome to the meeting. We've got kind of three main items on the agenda. I'm hoping that we can spend significant time on items 6 and 7, so that because they seem to be the chunky items of the agenda. So, Richard, I need to ask you whether we have apologies for absence and substitute members.
Thank you, Chair. We have apologies from Councillor Alison Eastwood and Councillor Susan Gaskell, and we've also got Councillor Ron Furman in attendance as a substitute. Thank you, Chair.
Thank you. And we have two speakers on item 6, Councillor Ashraf and Mrs. Jean Lineker. And we'll hold on till we get to item 6 for you to speak at that point rather than have it at the beginning of the meeting. Do any members have any declarations of interest? In which case, can we go on to the minutes of our meeting which we held on the 9th of March? Are they a correct record of that meeting? I'm assuming that we're saying yes. Thank you. I have 3 announcements as usual. One is that we're recording on YouTube this evening. So can we all try and remember to speak into the microphone? If we all speak up, then everyone can hear well. That would be good tonight. Yes, we will do our best. Just yell if we're not, because we all develop bad habits as we go. So if we can speak close to the microphone and clearly, that is good. We're not expecting any fire drills tonight. Democratic Services will assist us if that happens, and Richard is the best man probably in the council to advise us on that. And can we all make sure our devices are switched to silent? Excellent. So I'm now moving on to item 5, which is the annual report of this committee's work over the last year. And I think I'm going to ask, are you going to Democratic Services to introduce?
Yes.
Yes.
So every year this report comes to this committee and presents what has been discussed at meetings and the outcomes and the work that's been carried out by the committee in the previous 12 months. So I'm going to take this report as read, but we'll summarise the topics that have been covered by this committee over the last municipal year. So the committee has held 6 formal meetings during 2025 to 2026, and tonight's meeting is the final meeting of the municipal year. Some of the key areas of work completed by the committee have included the remit of the Adult Social Care, Health and Communities Overview and Scrutiny Committee, the overview of the key priorities, risks and challenges for the service areas within the remit of the committee. There have been several development of the committee work programme sessions throughout the year, the Northamptonshire Integrated Care Board overview of development and priorities, the Neighbourhood Health and New Models of Care programme in Northamptonshire Local Area Partnerships, Public Health and the overview of key priorities, risks and challenges, Community Safety Partnership Annual Report 2024 to 2025, the Draft Domestic Abuse Strategy, the Scrutiny Prioritisation Toolkit, Adult Social Care Performance Monitoring Report, Adult Social Care Workforce Planning, Introduction to Prevention, Priorities and Challenges relating to the delivery of adult social care, Adult Social Care Workforce Planning again, and Outcomes of the Care Quality Commission Inspection of the Council's Adult Social Care Function. Nice catchy title. Full details of all of these topics that we've covered across the 6 meetings can be found in more detail within the report. And that's it. If anyone's got any questions, I'm happy to answer them if I can.
Are there any questions on the report? I think it's for this committee to note at this stage, and it gets presented to the annual meeting of the, and it goes to the annual meeting of the council.
It might take a few seconds to warm up.
Left hand.
All technology is taking a while to walk.
Yeah, it's turned on. It's just...
It was just, if I've got the right report from memory, you did mention in the report, so is this the annual report that's under your name?
So I do a forward to the report.
Oh, right, yes, that's what I meant.
Yes.
There was a mention, which I was pleased about, the deprivation of liberty. I can't hear it.
There we go.
Hello? Hello?
Yes,
Yes.
we can hear you. Yeah.
About the deprivation of liberty, but I was so shocked about it. I'd love to just put the number in as well, because just to make it clear to others reading it, the scale of the problem. I know that we're
Can
dealing
that,
with it
yes,
and whatever, but it was over 1,000, I think,
Yes.
and I was shocked, and I'd like to think other people were shocked.
Right. Yes,
That
we
was
can
all.
we can add that to
Just
the
the
report.
number.
Yes.
Thank you.
Any other comments, or in which case, can we formally note that as a committee, and that will go to the council meeting? Thank you very much. I'm on to item 6 at this point. So this is the domestic violence strategy. I'll ask Mrs. Lineker, would you like to come and speak on this item?
I think you've already met me before on this issue. This is the last time I'm going to speak about this. I was sexually abused when I was younger, and so was my sister. I just need to turn around and tell you what it's like for a bad memory. And all those that are sexually abused by their parents and by the adult area will always remember this. We need a proper strategy for the abused children and the abused adults in care. The problem is there's not many social workers available on older care. When they are, they get stressed out, and I don't blame them either, because they have too many cases, and the same with children in care. I'm sorry about this. I have spoken to this on many occasions when the Conservatives were in control, and I'm sorry it's still happening today. End. Sorry I've had to be brutal.
No, I think that's always important for us to be reminded of that, and the importance that we have staff with the right understanding of what people have experienced. So thank you very much. Councillor Ashraf.
So I'm going to read off my phone if that's okay. Thank you, everyone. Despite the years of strategies and partnership, working outcomes for many victims of domestic abuse have not really... Can you not hear? Okay. Despite the years of strategies and partnership working, outcomes for many victims of domestic abuse have not improved, particularly for marginalised communities. I was once tried to be silenced by my very own community, but it didn't work. They didn't realise I had a voice and I was going to exercise it. So over 30 years experience working in domestic abuse, I have seen so many different challenges that women and men have faced. I am still seeing the same issues. Women are not believed, they are being judged, and when they disclose abuse and many not engaging with services at all, makes a huge difference for the abuse to continue. So the issue is not awareness, it's that the system is not working equally for everyone. The strategy needs to consider a community-led, culturally competent model that focuses specifically on those who are currently not being reached. For example, if we provide a specialist advocacy community outreach and safe access points outside traditional statutory routes, because for many of those women, routes are not trusted or accessible. What makes the difference is that it is built on lived experience and designed with communities, not just for them. We're not duplicating the existing services, we are reaching those who are currently excluded from them. In terms of outcomes, we are focused on measurable change, increasing engagement from marginalised communities, improving victim experience and trust, enabling earlier intervention and reducing repeat harm. This will only work if we have a global idea on looking for different ways to reach people. This is not about doing more of the same. It is about delivering a response where current systems are not working. Thank you.
Thank you. And I think hopefully we will pick up those points as we go through Vicky's presentation. So important points which we will hang on to. So welcome, Vicky, to the meeting. And I think we've had a chance to read the strategy, but it will be good for you to present it to us, and then we will hopefully ask some questions.
Yeah, no, sure. I think, so I did come within this year with the kind of draft strategic objectives. I want to say, I mean, that might be nearly 12 months ago, which is terrifying, isn't it? October. Okay, maybe not 6 months. So there isn't a huge change in those strategic objectives, which is good, because we had a really good discussion last time I came. But there are some slight changes. So I'll just take us through. So I suppose just a reminder: the strategy it's a joint strategy between both North and West Northamptonshire. And it's very much a strategic commitment to prevent domestic abuse and sexual violence, protect victims and survivors, and hold perpetrators to account. Domestic abuse and sexual violence, it is recognised in the strategy that it's very widespread, highly harmful, and often hidden. Pick up the points that Rafia mentioned, with significant impacts on health, homelessness, safeguarding, serious violence and community safety. The strategy is survivor-led. I know we spoke about this last time. It's absolutely informed by lived experience of survivors, but also frontline professionals. And we conducted a comprehensive joint needs assessment, which also fed in to the strategy. I think the strategy itself is structured really clearly. Hopefully, it outlines quite clearly our strategic commitment, and what will follow with the strategy is an action plan. So it's a 3-year strategy. The next steps for us will be to develop a 12-month action plan. So what does that look like? And there is a series of recommendations, or what will we do within each of those priorities that are listed in the strategy. But we will pull together a really clear action plan with accountable owners, timescales, and aligning some funding to the delivery of that action plan. So just without kind of going through everything, there are some bits I suppose to just pick out. So the strategy, why it matters. So I suppose the scale, kind of locally, what it looks like for us. So strategy details 17,500 domestic abuse related incidents recorded locally last year. Women are disproportionately affected as victims, while men 10 more likely to be perpetrators. High levels of abuse among children and young people, including sexual violence under 18, and certain groups face additional barriers to safety and support, and that includes groups with specific protected characteristics, disabled people, LGBTQ, rural residents, men and boys, and you know, as Riffy has alluded to. So the strategy talks about a whole system preventative approach, and it's not just about crisis response. So yeah, so it's not about, you know, just dealing with high risk victims. It's around prevention and early intervention, and hopefully that comes through. I think it comes through in strategy. So 5 really clear objectives: early intervention and prevention, support and protection for all victims and survivors, trust and confidence in services.
Especially when they've lost school.
Yep. Coordinated community response and partnership working, and holding perpetrators to account. So the objectives balance prevention, protection, system reform and accountability, rather than relying just on enforcement alone. So in terms of governance of strategy, we have a joint domestic abuse and sexual violence board. So it's a north and a west board that feeds into the respective west and north community safety partnership boards. They have a statutory responsibility to oversee the delivery of the strategy. So 2 places, 1 board, 1 vision. And the reason that we've done that is to ensure that we've got consistency across the county, but also to reduce duplication. So I've already mentioned there'll be an action plan that will sit underneath the strategy. That will be a live document that the board will work to. And the strategy will have a midpoint review in 2027. So there's a clear, detailed performance framework within the strategy. So I won't go through those, but it's really clear how we're kind of going to measure that performance, and I think that's probably the key bits that I wanted to mention. Yeah, but there is a lot in the strategy
yes,
itself.
Yes, there is.
You've
and
seen
we've
that.
all
Yeah,
had the opportunity
absolutely.
to read it. Really welcome the emphasis on prevention work. I think that's really, really right, and hopefully that will join up with other prevention initiatives within the council. But Councillor Chauhan, I think, was the first to indicate.
Thank you. Thanks, Vicky. You've been working for quite some years on this, and good to see you after so long. I've got a couple of questions, actually, so I'm going to try and frame them. One question is, you mentioned the stats around women being impacted, and largely by this. How confident are we that the men are actually coming forward and reporting it? Obviously, I've experienced a few things in some casework that I've carried out lately. And one of the things that's becoming apparent is that there's a stigma attached to it. Men obviously aren't coming forward. So the first question is, can there be some kind of public campaign around this to try and make men come forward if they have experienced something around this? Have we already worked on that? It might already be in the strategy. That's my first question. The second one was, there's a paragraph in here where you've mentioned that sexual violence is particularly evident amongst younger age groups, with 70% of non-domestic sexual offences reported by those under 18. Okay. I've seen this pattern emerging with a lot of schools at the moment. It's quite shocking, the peer-on-peer abuse that's going on. And one of the things that's really apparent is that when there are children that have experienced domestic or sexual violence within their own homes, that's then being inflicted on other students. Are we working with children's services as well to ensure when we are picking up those cases in adults, are we ensuring that we are keeping an eye on those kids as well to ensure that abuse is not being then conflicted on other people? I know there are a couple of looked after children that I've been made aware of where this has happened as well. And there seems to be a protection around that forming. I'll be very open and blunt when I say this. I understand the protection that's needed around looked after children. But there also has to be some kind of protection for those other children that are being impacted as well by that behaviour. So I just wanted to understand, are we working together with other departments? So that's the other question. And my third question is, you mentioned homelessness. I'm a trustee at the Hope Centre, and one of the things we find is when we have got women that are homeless, they're more impacted by sexual violence. Are we doing any outreach around those women and making sure that they're protected as well? And is that part of your strategy? Thank you. I know there's a lot there. Thanks.
Yeah, we'll kind of do it in reverse, I think, with the homelessness one, if that's okay, and I'll answer that. So just in terms of homelessness, obviously we know that there is high risk with domestic abuse. Sorry, okay. Yeah, obviously with homelessness, we know that there is often high risk of domestic abuse, and also domestic abuse can lead to a lot of our homelessness cases in terms of the numbers that are coming through. We're obviously currently working on the future target operating model for housing, and the strategy is very much going to lead some of that work. A number of the domestic homicide review cases that we've done have also highlighted the need to ensure that our housing services are asking the right questions, and part of the strategy will be to make sure that that training is in place, that we are recognising indicators such as rent arrears, various things can indicate that there are wider problems, and that training is being embedded through. Some of those findings also from that is also around exactly what you've described, where it's a male victim, that the system is not necessarily taking it as seriously as when it's a female victim, or not as readily to accept or notice the same signs that you would see. So there's quite a lot of work that we're doing within our early intervention to make sure that we're picking that up. We're not completely there yet, to be honest, Councillor Charan, and I think we need to do more work on it, and working with our partners and that shared board and our housing, embedding it within our housing practice and pathways is going to be an important part of this. And again, happy to come back to, we've obviously got housing scrutiny, which is separately, but on this subject, happy to come back in here to discuss that further.
Could I just pick up in the report, there seemed a real disparity in the numbers in terms of need for emergency accommodation between the north and the west. I just wondered whether you had any thoughts on why that might be. Or do you need...
I don't think I can give you the exact answer for that. Yeah. What we do see is that obviously Northampton is a more urban area, so in terms of emergency accommodation, we will get more cases in an urban area, right, but also out of area, people are more likely to come into Northampton for support from out of area.
Yep, okay. Sorry, I interrupted Councillor Chahan's 3 points.
So I think, are we working with children's services? So
it was more around when we are picking up the sexual violence or domestic violence in adult services, are we working with children's services 100%. To identify and keep an eye on those children who have experienced it, to ensure that that's not being inflicted on peers, because it's a pattern. I've never experienced it as frequently as I have now, working with parents and children coming forward. So it's a bit concerning that I'm seeing that. And your point there just kind of triggered what I'm actually seeing on the ground.
Yeah, and I think so yes, absolutely, and automatically, if a referral has gone through the police, there's an automatic contact with school. So yes, that's happening. But we want to do more early intervention around those kind of appropriate behaviours. We've done some really good pilot work around healthy behaviours, so which is tailored, age appropriate, obviously, to the different year groups. We want to do so much more of that in strategy, in the action plan. So as we develop the action plan, some of that work that we've done previously in schools to tackle exactly some of those behaviours. We want to do lots more of that, and there's some good stuff that we've done locally, and there's some good stuff nationally that we've seen that we want to invest in.
Okay, and then there's the other question as well, which was around awareness and making more. So making, if a male has been a victim of sexual violence, for them to be able to come forward and not have that stigma. So getting rid of that stigma, are we doing anything in terms of, I know this might be a bit of public health in here as well, but are we doing anything around that?
Yeah, so we mentioned in the strategy, don't we, some of the specific groups that are facing barriers. So I think it's absolutely something that we would like to do more of. as we develop the action plan. So I suppose the strategy kind of recognises our intent, doesn't it? And then the action plan is actually what we do. But yeah, I think, awareness campaigns, great idea. I absolutely agree. There was some debate over, a strategy that focuses just on violence against women and girls, and with discussion with survivors, with discussion with partner agencies, and also the support agencies that are supporting victims and survivors, it was felt that actually domestic abuse and sexual violence covers everybody. So we're aware of it and absolutely want to do some stuff around it.
I'm just going to come back to this. I'm saying this because I've been recently working with someone who has, and it took them 4 years to come forward. And, it happened to them while they're at school, took them a lot of years to come forward, but it was because of the stigma. Yeah. So I wonder whether there's going to be a separate strategy. We always focus on women and girls. I'm a woman myself. There's nothing that I would say, but, I think that's a good thing. But I think there needs to be a strategy focused on men as well. Yeah. Thank you.
So I'm sure it's in the strategy specifically, but we do have male refuge in our county, which is not the norm nationally. So that's something that we're fortunate to have, and will continue to invest in as we commission our new safer accommodation services.
Good, thank you. Councillor Herring.
There were a few things that struck me, because I don't think I saw this. That I'm a late comer to this committee, so I didn't see this the first time round. Just as a minor little point, on page 29, there's a spelling error that you might want to correct, because it says sexual violence instead of violence. Yes, you might want to correct that. Two things that occurred to me. One was, you don't mention marriage guidance counsellors, who are probably going to be some of the first people who are aware that there's problems in a marriage. You haven't mentioned making connections with them, so I thought it might be worth adding. And the other one, I think I've probably said before when we were involved in housing, was that it shouldn't be the victim who has to flee, but we should be doing more to protect them in the home. And it's a bit triggering this report, because I have to say I have personal experience of this through my daughter, who turned out to be married to a coercive controller, didn't realise. My daughter spent a long time trying to hide it and keep it all together, looking everything was fine. It all came to a head. She had a 1-year-old daughter. We ended up with, I've lived the whole thing, the forms, the CAFCAS, restraining orders, police cars parked on the lawn because he'd locked himself in the house with the baby, and there was a sort of potential hostage situation. I mean, and the fear, as a grandparent, never mind for her, of what he might do next. He was absolutely out of control. And it's that, I mean, things have calmed down. He's married. I don't think he's married, but he's got 2 other children, but he used the court. The courts were useless. He started, when he couldn't exert control any other way, he used the court system to exert control. So had her in court at least 6 times, not, wanting this, wanting that, wanting this access, refusing that. Even on Christmas Eve, we were in court, and that was very costly. Nor would they, having proved that there were 6 different aspects of coercive control. I seem to remember we had proof of every single aspect, with financial, psychological, sexual, the whole lot. And still, when she asked not to be seated or near him in court, they ignored it. So, I mean, the courts were rubbish. And there is also the fear for people. The council are not a trusted partner in this, because they're terrified if social services get involved that they might take the children. So you're battling against that as well. So I'm just saying this is lived. It can happen to anybody. I know there's many other different types that you're trying to protect, but you know, just because you've got a nice house and you're middle class and whatever, the idea that she had to hand over a 1-year-old baby that she'd only just finished breastfeeding to a husband who was living in a rented house with a unknown girlfriend. And the other thing you haven't mentioned actually, it's reminded me now, is the I've forgotten the law where people can ask what the background of partners is. Claire's law, thank you. That's not in there either, and I think it should be. And I think there's an additional one now is being advocated for parents to be able to family members to be able to find out the background of partners that they are concerned about. So anyway, that's
thank
me.
you. No, thank you very much. I think the issue of courts has come to light quite a lot recently, and I think how we... Yes, sorry, over to you.
There is, I'm sure there is reference in the strategy around the court adverse. And I think there is mention definitely around our IDVA service, our Independent Domestic Abuse Advisor Service. So they are advisors that support those victim survivors that are at highest risk. So the Office of the Police and Crime Commissioner has invested some funding into IDVAs to support at court. Because that is a really challenging and really difficult time. They've invested in a few roles that will support women whilst they're going and men whilst they're going through that process.
There is, and I can't remember because obviously she couldn't afford to get lawyered up on every occasion. And there's an advocacy thing. Was it called the Alexander? They're allowed to have an impartial, because obviously they're all in camera family court, but she made contact with somebody who was able to come and be an impartial advocate, although not a lawyer, with her, and I think it was called something like an Alexander or something. Yes. Which was very helpful because obviously they can't get financial support anymore for lawyers.
I think the phrase is Mackenzie's friend. Yes, thank you, Richard.
Sorry, through you, Chair, and if I can just answer on the maintaining the victim in the properties. That's a clear part of our strategy and approach in housing terms to try and do that. One of the biggest barriers to that is the victim still being in a space or accessible to the perpetrator if they are not prepared to press charges or they're not prepared to move forward, or as you've said, there's issues with getting it through court or through any of those processes. So one of the things we clearly have to consider in housing is the safety of the victim and the environment they're in, and quite often an out-of-area placement, even if it's within our own area of West Northants, may be better. So that's considered in any assessment.
But in terms of technology, you've got cameras, panic buttons, all sorts of other things that can be used, and I don't see any more detail there, but it'd be quite interesting to know, now technology's moved on, what sort of help could be given so that in situations like that people can stay in their home but feel as if they've got some protection.
We do have target hardening and sanctuary included in the strategy, and absolutely we're part of our actions. We already invest in target hardening, and we'd like to do more of that. And the strategy does talk about that, Rosie.
Every circumstance is so unique and different, so you've got to have all the tools available, haven't you?
The more tools we've got, the better we can. The better service we can provide.
Councillor Cartwright.
Thank you, Chair. Yeah, this it is a serious issue, obviously. It has been alluded, as has been alluded to by our speaker and our councillors tonight. A lot of this is family and friends driven. And of course, the younger you are, you're looking at your family as your support group, so it's difficult, obviously, to get them to come forward and say, there's an issue. So I take it you're specially trained people that can help looking at that. But I'm also conscious from experience of in my previous employment that these people do tend to go on and become the perpetrators as well. You know, I don't know if it's we didn't know or it happened to me so it can happen to you. I'm not sure which way around that goes. If you don't know any better or if you're just lashing out with it. But I'm not sure that when that gets raised in levels and how you would spot that early, I don't know. But I'm aware, you know, any family, any type of family, you're not looking at any set people. This is a thing that goes on in the human race. It's disgraceful. And I wish they would be held to account more firmly, but that's not the case as we hear regularly. I thought I'd point that out. Thank you.
Yes.
Yeah. Oh, thank you, Chair. Yeah, I mean, I was going to just welcome the strategy because it's so comprehensive. Really pleased to see it. And, you know, I think as other people have said as well, I think, you know, domestic abuse most families have experienced some kind of domestic abuse within their family. I mean, I have a sister who was domestically abused and I have a sister-in-law who's been domestically abused. I have a husband who was domestically abused and I myself have been domestically abused. And you know, one of the things I'd welcome particularly is the LGBT side of it, which again is very underreported. My own experience a good few years ago was the police just didn't take it seriously because it was two blokes fighting, you know, and they weren't really interested in looking into deeper as to why that was happening. I think the world is getting into a better place in some respects, but there's still an awful long way to go, and some of the national political context we're seeing where it seems to be becoming acceptable to abuse people and to verbally in that respect and to call out differences and make differences with people is not helping. But I do welcome the strategy. I think it's very good. One of the things I was trying to see, because I know the council supports the White Ribbon campaign, which is about educating men and young men about how they should be treating women. I think that's quite an important part of helping the prevention case, and I think that's another one that could be good to be included. I think I said this last time, great strategy, really interested to see the action plan. I think that's the important thing, and hopefully, Chair, we can look at that as a committee once that comes back to review it. So, yeah, I would welcome it, and I think it's great to see it so encompassing. But obviously now the next challenge is to make it happen.
Yeah, I just want to touch on Andrew Simpson's point, Councillor Andrew Simpson, with the young men stemming across. Obviously, we've highlighted from children, this is adults, but highlighting the transition from children and families into young men. Just highlight the dangers of the online, and I know obviously there's a lot of work going on with the government with banning, obviously, social media for children. Young secondary age children largely in schools, but you know, where are we really and what input can we have as a council into what's online, in particular influencers? 40% of young males think that Andrew Tate is acceptable, which is shocking.
Share your frustrations with much of that, and it is really difficult. It is challenging. I think some of the stuff I mentioned earlier around the appropriate behaviour work, healthy relationships, challenging some of those attitudes and behaviours. There are programmes out there specifically available for boys, kind of, you know, school age boys, young men, and I think that is absolutely an integral part of our strategy and our action plan to do some of that work. We've got a really good relationship with schools through the Community Safety Partnership. And Debbie in my team works really closely with the education team, and they have about 96 schools through our safeguarding schools meetings that meet really regularly and talk about a variety of issues. And some of these issues, as you can imagine, come up. So we're knocking on an open door in terms of the schools really wanting to work with us, and they do work with us on a variety of community safety related issues. And this is another one where we know the schools waiting to work with us.
Thank you. I've got two points to raise. One is when serious incidents go wrong, it's usually because agencies have not communicated with each other and passed on information and shared information. This is all based on partnership, but are there issues within Northamptonshire, West Northamptonshire, where kind of communication could be better, or those relationships can we be assured that those are that we won't have an incident because information is not shared between agencies, I suppose, is the question.
So I don't think you can ever be fully assured that an incident would happen because information hasn't been shared, because there is room for human error in some of that anyway. What I would say is I'm the chair of the Community Safety Partnership. Through that partnership, we have really strong relationships with our colleagues in police, in the Office of Foreign Police as well. So along with Children's Services, the Housing Associations sit on there as well. So we have kind of major discussions to make sure that our strategies match up, to make sure that we have action plans, and we're watching the figures all the time. So if there is things going the wrong direction, we've got a specific issue, we will put a focus onto that, and as a group we'll look at how we do it. So partnerships are stronger than ever been. Our figures in terms of that crime reduction are better than they've ever been. However, I can't say to you that would never happen, because that would be impossible to do, but we're certainly working on all the right things to stop that. I think if we can show you the action plan at a later stage, you can see the type of actions that are happening, and that will help you with that.
And I suppose my second point was about the monitoring bit, and I was just a bit concerned, sorry Jean, monitoring that there were kind of too many things to be monitored, probably by too many agencies, and whether there's a way of, when you get to the action plan, really simplifying that down so that everyone knows what they're monitoring and why, rather than what appeared to be, it'd be unfair to call it a scattergun approach, but almost too many things to monitor, really.
Oh, turned it off. That's interesting. So I thought there wasn't enough. No, I think that we absolutely, when we look at the action plan, need to perhaps firm up the monitoring. I think it's the Domestic Abuse and Sexual Violence Partnership Board that will oversee the strategy does have a breadth of partners on it. So there are a lot of people involved in this, and it does span across, a variety of services, internal services, but also through external partners. So I do think it is, it's a really important issue. It's a big subject. Yeah, there are quite a few things to monitor, but I think we want to make a big impact.
Yeah, and who does that get reported to, I suppose, is the question. Yes.
To the board.
Right.
To the board, quarterly to the board, and I think, happy to bring back an annual update as part of the community safety. We bring the community safety strategy update here anyway, don't we? Yes. So we can bring that separately to this group as well.
That would be good. Councillor Chauhan.
Thank you. 2 questions. One is, when we have instances in the community where people have either reported something in terms of, some of the casework that I've just brought up at the moment, we normally go through like members' inquiries and so on. But I think when it's something urgent like that, we need a clear line of who to contact, whether it's the directors, whether it's external agencies or so on. I think that information would be really important to share with all councillors, just so that they know what way, who to report that, whether it's children's, whether it's adults, whatever it is. I think that would be really helpful to get that circulated. I don't know whether that might need some training or something. I've done this for almost 10 years. It's different. I'm sure we've got a lot of new councillors on board who wouldn't know what to do. Even I, at this time, is still not completely clear of what that process looks like. So that would be quite good to have. The other thing I wanted to ask was, and it goes back to what Councillor Ashraf said at the beginning, and then looking at the strategy on page 10 with violence against women and girls. So was it on page 10? Sorry. And it wasn't page 10, sorry. It was talking about, I've lost it. I think it was talking about honour-based abuse and the law. I think there's a page 9 it is. When I was in Bedford, when I stood as a parliamentary candidate there, it was something that was brought to my attention frequently. A lot of women who couldn't speak English, a lot of violence was being perpetrated in those communities. And those women on purpose weren't educated, they were kept behind, couldn't read emails and so on. And they were saying to me, actually, we are experiencing this, but we cannot speak to anyone. We cannot speak the language. Firstly, it's wrong to keep anyone in that way, obviously. But number two, if we have got communities who are experienced that who cannot speak the language, are we doing any outreach to those? Is there anything that we can do to encourage those women to come forward? Because I think Councillor Ashraf mentioned earlier, you know, they were trying to silence her. That does happen. I've seen that happen, and a lot of those women were coming forward and saying that, and I'm sure it's happening here in Northamptonshire as well. You know, so I think that's something that we need to pick up in this as well. Thank you.
I think they're statements, aren't they, rather than anything else. But absolutely, I agree with both of them.
Sorry, not a statement. I suppose the question then is: are we putting anything out in terms of reaching out to people, you know, educating them, like you know, FMG is wrong, or you know, those types of things? Yeah. So absolutely. When we have general, we do a lot of specific general comms, awareness raising, 16 days of activism. Some, you know, coercive controlling behaviour campaigns, and I think it's probably fair to say generally it's quite generic. So for them to be more specific and targeted, I think absolutely that's something that we could and should be doing. I think there's a step further, isn't there, in terms of some of those support organisations that would support or that are in those communities, working in those communities, and how we work with those, and some opportunities to work with those groups specifically. In terms of the training and the counsellors, absolutely we can put something out. Again, we do it occasionally, every now and again. Julie, our domestic abuse and sexual violence coordinator within local authority, did some training. I think about 30 counsellors attended. I think it was around the time I came here, so perhaps around October. So we can definitely do some more training, and I would encourage as many counsellors to come. Sorry, we've done so much training. It's not about the training. It's almost like a script sheet. You know, if this happens, contact this person. If this happens, contact that person. Just something really simple. You know, who the contact is, what the number is in an emergency.
So we can do something really quickly in the members' briefing.
Perfect. Thank you.
That'd be really useful. Yes, good. Thank you. Have we got any further questions? Yes, Ron, come in.
Thank you, Chair. Most of the questions have already been asked. I've done it rather methodically. First of all, how will the workforce capacity risk be identified and managed over the lifespan of the strategy? And then secondly, you know, survivors' experiences, will they be used to measure, if you like, how we are actually doing in real terms with the strategy and for future outcomes? Thank you.
So I'll answer the workforce one. In terms of how we would look at what capacity is needed, we would assess what the need is in any 1 year, and obviously as we're budget setting or we're setting forward our service plans, we'll be looking at what resources needed to meet need and how we make best use of resources across all of the areas. So we also have, as you will be well aware, the Northamptonshire Partnership Homes services coming back in. It will also have domestic abuse response in there. So part of what we'll be doing is looking at how those services fit together well within those pathway. But we currently feel that through the strategy and through the contract that we are procuring, we are procuring the right capacity for now, including that from the voluntary sector and some of those outreach organisations. But that will be assessed through evaluation of, are we meeting need? What are the numbers doing? Is there a further need, or is there different types of need, obviously, that need to be addressed as we go through that? So it'll be under constant review ahead of anything else we're doing.
So was the other question specifically around how do we keep ensuring that we've got the victim's voice?
Sorry, can I come down to it here?
Yeah, sure.
Microphone. Oh, sorry. Right. was it now? I wrote it all down. It was how will survivor experiences be used to test whether services are improving in real terms?
So I think in terms of the services that we commission or that we fund, as we developed the strategy, we used victim survivors were centre to developing the strategy, and we feel that victims' voice really is through that. It's a golden thread through that. We want to continue that. So we've got a victim survivor network group. We've got we work really closely with organisations that are supporting victim survivors. Obviously, we'll have monitoring in place to hold some of the providers that we're commissioning to account through contracts and things like that. But I think for us, it's continually getting that voice as we go through over the next 3 years, as we develop the action plan, test some of that, as we're doing some of the interventions and initiatives, getting some feedback on those, some evaluation, some schoolwork and the prevention work particularly that we want to do. Some of that's been nationally kind of tested already with victim survivors, but we'll do some of that locally for ourselves as well to ensure that what we're investing in is value for money and it's making a difference. It's having an impact.
Thank you, by the way, thank you.
Right. Thank you. I think we've reached a point where, so this strategy now goes to Cabinet for approval, does it? Is that the next step for that? And I think could note the report, welcome in fact, stronger than that, I think we should welcome the report and commend it to Cabinet. I think there are a whole series of issues that we've raised, and we will look forward to having an addendum to the community safety report that will be some of the monitoring outcomes relating to the strategy as well.
And we're happy to bring the action plan,
and a
copy of the action plan back if you like.
Yes, that would be good as well, yes.
Is this set in stone now, or can any of these comments be incorporated if you feel it's appropriate?
Yes.
So I've been making notes as I've been answering the questions. So the strategy has gone through overview and scrutiny in the north too. So what we will do is collate everything and then put in and tailor some of this. So if anybody has any kind of reflections afterwards, then please send them through, and we're happy to have a look at those.
Excellent. Thank you. Thank you very much, Vicky, for your presentation and for the work that's gone in with your team and with the team in the North putting this all together. Very welcome and good stuff. Thank you very much. Don't feel you have to stay So we're now on to, let me get my notes. So we're now on to the Adult Social Care Performance Monitoring Report. We have a paper that sets out some of the issues there, but I think I'm going to invite Mel Williams to do a presentation, kind of perhaps drilling into some of those things in more detail.
Yep, thank you, Chair. So we were... Yeah, that is now, isn't it? Yep, so thank you, Chair. We were asked to present across all 4 areas of committee's business a sort of a wrap-up of performance for the year, and particularly, Chair, to give a focus to how this links to the Cabinet dashboard that you see, and that you felt that there wasn't a link between the Cabinet report and committee business, so we're doing that. And equally, drawing to committee's attention areas of performance that you may want to consider for your work programme for next year. So that's the intention. So you'll be hearing 4 presentations, myself on adult social care performance, Ashley on care quality, Jane on communities, and David on public health. And I'll take your nod, Chair, as to how much we break for questions, but we do want to sort of cover off the 4 presentations if we can.
I wonder if with the committee's agreement, we say, give us the whole presentation to start with. We can make notes of questions as we go along, and then we perhaps organise our questions a bit thematically as we go along so that we aren't dotting around. The danger is that we end up dotting around too much.
Yeah.
But we will try and keep some order to things.
Thank you. And Wendy and Richard will have the slides, so they will be available to members. So in terms of adult social care, so turning to the Cabinet report, there are 6 indicators that are in the Cabinet dashboard. They won't be the same indicators into next year because I don't think these are particularly the best measures for adult social care quality, but they are some of the measures that get looked at nationally, and these are certainly sitting behind the outcome in the Care Quality Commission assessment of our services, so they are key. So in terms of admissions to residential and nursing care, we track these for both older adults and working age adults. And nationally, it's seen that what you're really aiming to do is to enable somebody to live with their own front door. There isn't a particular target in terms of what good looks like for each group. It's much more about meeting needs. But generally, we would try to be reducing the amount of people that we are supporting institutions and increasing the amount of people that have their own front door in some sort of shared or individual living. What we've seen in older adults is that we're becoming more and more reliant, particularly on nursing care, and that we've seen an increase for working age adults, particularly those with learning disability, for those we support in residential care, and there are trends that we're looking to reduce into this year. In terms of safeguarding, our performance is really strong, so we've noted that in the Cabinet report, and that was noted by the Care Quality Commission. We look at a whole range of indicators for safeguarding, but this one looks at where we work to include safeguarding being personal, but particularly as important is that we look to where we've reduced the risk through our work. It would be a bit concerning, wouldn't it, if we were not addressing risk through social work. So that's a really important target for us as well, which isn't reflected in the dashboard. In terms of Care Act assessments, in the corporate dashboard, we track the numbers, but I think I'm much more interested in waiting times. So I have got the waiting times on a slide. I'm thinking, Ashley, is that on... It's one of the slides in the pack, isn't it, in terms of waiting times? And Councillor Herring, you've raised the waiting times for dolls. Tracking numbers is fine because it gives us an idea of how many people we assess, but it's much more important to understand how we completed them, whether we completed them in a timely way. So we do have information on the waiting times, and we have seen waiting times reduce dramatically this year, particularly for occupational therapy, equipment, and for older adults, waiting times has been a big improvement. For dolls, waiting times, I'm just looking at, I think it's slide, I've got 22 slides, I wasn't going to show you all of them. Maybe, Ashley, if you can have a look at which one is the waiting time one. For dolls, there remains, as you've pointed out before, Councillor Herring, a large waiting time, but it's just to give the assurance that we do continually assess risk. So deprivation of liberty will be a whole range of interventions. It may be that I need to have my bedsides raised to stop me falling out of bed in the night, would be one example of a deprivation of liberty. Another might be that I'm not able to be given the door access code to leave the building because it would be dangerous for me to leave. So you've got kind of those types of where we deprive someone's liberty, but I would say they're low risk, all the way up to where there may be a higher risk in terms of the way we support somebody to be mainly cared for in a bed, for example. So what we do through the dolls is to triage that level of risk. So whilst the waiting time is still concerning, we are quite assured that the urgent work and the more risky work is constantly triaged and assessed. And we do make sure we've had other contact and through reviews, because the dolls includes having a mental health assessment, a doctor's assessment, a best interest assessment. It's a complicated multi-agency assessment to raise, but it's just to give assurance that we do track those waiting times. Poor Ashley's trying to find the right slide.
One, yeah, you went past it. Which one was it? Go back. There at the bottom there. Go that one you were.
There we go.
Slide 12.
Yeah.
Sorry, my eyes can't see the screen.
Next one along. Sorry, Ash, next one along.
So that hopefully, Councillor Purser covers off the Cabinet report. What I also wanted just to show you was slide 22. That is where there's the dolls, isn't it, on slide 22? So we were as you know, because we presented last time about the Care Quality Commission assessment, and waiting times and inconsistency of access to social care was one of the key improvement areas. So into next year, one of the areas that we're going to be absolutely determined to improve is the waiting times for assessment across all of these different areas of adult social care and adult social work. So this is going to be absolutely crucial for us going forward. DOLS is an aspect of that, but equally so is OT assessment. As I said, that was a big improvement concern in the report, and through the year, our principal OT has made huge progress in reducing that waiting time down dramatically, as have our two service managers within the older adults provision who've rapidly reduced the waiting list for adults for assessment. So we've had some really strong performance through the year, but we still have further improvement work to go. So one of the things I would suggest, Chair, that we can consistently review into next year is continue to have the regular performance report. We can still report on the cabinet indicators, but I think it's important that you see those. But I think it would be prudent to also have a look at waiting times as one of the key indicators. So if I might now just pass to Ashley, who's going to talk about care quality. And care quality is about, and we've had this conversation at Scrutiny last time, is about the level of care that we commission for people to, to live good lives.
Just doing the admin, bear with me. Okay, thank you very much. You hear me okay? Yeah, okay. So quite used to coming to Cabinet, but I think this is, to Scrutiny, this is the first time I think I've brought the care quality profile. I think just to start off, there's a lot of work we're doing in terms of refreshing what our quality improvement plan is and how we're going to support our market in terms of their development to improve the CQC profile, but similarly to provide ourselves with more assurances over the safety and safe delivery of care that's happening across West Northamptonshire. So the very vast majority of providers who are CQC regulated in West Northamptonshire have a good or outstanding rating with the CQC. There's a very, very small number that have an inadequate rating, but any with an inadequate rating is not where we want to be at all. Those are the ones that we kind of target support with, and where we can't, we often find ourselves in a position where we have to move people to safer placements. So there's 131 services rated that are good, 14 are rated as outstanding, there's 52 that are rated as requires improvement, and there's 2 that are rated as inadequate across there. But one of the biggest issues that we have, and what kind of skews our reporting, is that in West Northamptonshire there are really high volumes of care providers delivering regulated services that have a not yet inspected rating. So they haven't been inspected, they haven't been given a CQC, and I think some members will probably recognise me saying that this is a problem. Regionally and nationally, we have a higher amount of not yet inspected than other authority in terms of the average of what we have. And what that kind of means is that if we looked at our CQC profile against the percentage, so what the percentage of our care homes, for example, had a good or outstanding rating, it will be skewed by the fact that there's a whole pocket of them that are not yet inspected. So the percentage of the market looks smaller. So there's work we've got to do, and we have worked with with the CQC to kind of start developing a plan on how they're going to be addressed. But I'm going to talk a bit more through that in a minute.
Ashley, can you go back to that slide so I just understand which one is exactly? So that one is that have been inspected, and this one is the ones that haven't been inspected.
No, the one on the left is the ones where you include not yet inspected, so services that haven't been inspected yet. And the one on the right is if you take it out. So I kind of think what I was trying to do was show you what the difference it makes in terms of the number or the percentage of providers that are rated as good or outstanding if you don't include the not yet inspected ones in. Right. If you do include it, it makes a big difference to what our percentage says.
Yes, right.
Makes sense?
So we need to clock that up. Right.
Could I just ask a question, just so that I understand it properly? Are we placing people in? Does the council place people in spaces that haven't been inspected? On occasions we do, but that's only if we do our own assurance checks beforehand. That's what I was going to say. We don't have to wait for the CQC to report if we have actually done an inspection to make sure that we are satisfied with the care. That's all I
You're
wanted to
exactly
know.
right.
Thank
I think it would limit our market capacity if we did have a blanket approach. It used to be something we had in place, but because of these delays in getting the inspections done, we removed that as a requirement. But obviously for us, it's really important that if we are commissioning services, we have to have our own assurances that they're safe. So we do welcome visits and we do monitoring inspections very early with them to make sure that they are of the standard we expect them to be at. Yeah.
Right, sorry, I said I wasn't going to interrupt.
No, really good
and
questions.
I've done it straight away, so here we go.
Thank you. No worries. So I talked a bit about the CQC challenges that we have. So the inspection frequency is a bit of a challenge for us. So as you can see, the average time between inspections of West Northamptonshire has increased from just over 3 years to just over 3 years is the average from March 2024, and now it's 3.5 years. So the challenge in terms of getting those inspections completed is getting worse. I think part of it is because we have in recent years had quite a lot of community-based regulated services open up and start operating, which has applied more pressure to the CQC in order to correct that problem. However, it's still a bit difficulty because the challenge we have is that people heavily rely on the CQC as their basis for their decision making. So when a family member wants to place somebody in a placement, they do often look at the CQC. Now, they could look at a report and say they're outstanding, but as you can see from this, if they're outstanding, the chances are it's been 5 years and 7 months since they were last time inspected. But similarly, it works the other way. So from a business perspective, is that they could be at requires improvement, but it has been 2 years since they were last inspected, and therefore they've done a lot of improvement work, and this is one of the challenges that we have. So we do keep an eye on it. We do work really closely with our CQC, and what they do is they prioritise their inspections on a risk basis. So they look at the providers who are presenting bigger challenges, and then they prioritise the inspectors on those ones where, for example, there might be whistleblowing, or there might be safeguarding concerns, or partner communications that have come through. So, which is the right approach to do, but it just still remains a challenge that there's some providers that still showing as outstanding, but the last scoring was 5 years and 7 months ago. So if we look at our care home market, we have some really positive things happening in our market as a general. So registered managers are really good registered managers are one of the most important things in terms of having good and safe services. We have a really high percentage of employed registered managers and quite low compared to regional and national benchmarking of vacancies in terms of the registered manager role, which is a really positive thing. We have encouraged our providers to invest in or to engage in Skills for Care, who are a national organisation supported to develop the skills of the workforce, and they do some really good training for new registered managers, so we've done a lot of encouragement on that. Our care home CQC profile is better than our community CQC profile. There are a few reasons for that. One of them is that care homes are accommodation-based care. The care is delivered in one single location. The environment's controllable. In a community-based setting, particularly in home care, there can be some challenges because there's visiting, there's delivering care in different environments, there's responding to the needs of individual people in their habitats that they have, and whether they have equipment needs and particular aid needs and things like that. It is common across the country that care homes are a higher rated. Ours benchmark quite well, so we've currently got 70.5% of our market that are currently rated good or outstanding, but we would like that to be better. Our community-based market is not so much. We are benchmarked lower than the national average, and we benchmark lower than the regional average. So it's only 42.2% of our community services are rated good or outstanding, and our target, well, the national average is 65.1%. One of the big drivers of that is the value of the number of the not yet inspectors that exist. So as I said before, there's lots have popped up in the last 2 years, lots of organisations that are delivering regulated care, haven't had an inspection yet, so our percentage does look lower, but it's still much lower than we would want it to be. I think that there's patterns as well, I think, across all of those, across the CQC domains, and I think across our market as a whole, safe and well-led is a bit of a challenge for us. So we're looking at our quality improvement plan to address that and to provide additional support in terms of addressing that particular CQC domain of safe and well-led. And then I think my last slide is basically our comparative data over the last 12 months. So I'll just pick up some of the positives and I'll go through some of the challenges on there. So one is what I've called is the registered manager coverage. It's really well. Safe, caring, effective and responsive domains from the CQC is has about remained the same. So we do need to do a push on that. We've got several of our measures now, they meet or are very close to the targets. When you remove the not yet inspected services again, but that's not something we want to work on in a way of having to remove that from it. I think the evidence of that says that most of our key domains that the CQC would look at when they inspect us have improved, with the exception of 4 of them. Those are the ones that really need to be the focus of what our quality improvement plan says. But there is really strong evidence when you look at this that the effects of the quality improvement work, the commitment of our care market is showing that it is moving in the right direction, just probably not at the pace that we want it to. And I think that's it for my report. So thank you very much.
Okay, we'll come back to questions afterwards, so don't lose the slides. It's Jay next.
We're doing a double act with me and Vicky, so that's why Vicky's still here, bless her.
Right, okay, okay.
What's Ashley bringing some up? So just to say with this, obviously with the communities team, they cover a wide range of interventions. This gives you, the report gives you a bit of progress across that. Obviously stronger, safer neighbourhoods. So we do a lot of targeted community safety work. Prevention sits just alongside that in terms of violence and antisocial behaviour enforcement. You will see our teams out and about trying to work with local communities to make sure that where we're getting reports of entrenched antisocial behaviour or high levels, then we'll work with those areas through those to make sure that we're addressing those as early as possible on a preventative basis. We also do enhanced place-based working, so local area partnerships is something that we've been working very hard with Vicky and the team to establish, including all of the ward members and including all of the local system leads, to make sure that we are taking an approach of shared responsibility with our communities to tackle the issues that they're facing. And then significant investment into communities. So through the grants programme, that's how we're looking to work the voluntary sector to ensure that we're investing in local interventions that work with some of the need that we're seeing across those areas from the partnerships and wider. And then resettlement and inclusion. So obviously we have high levels of resettlement working, particularly around Afghan and the Homes for Ukraine element, but also wider with some of the work that we're doing with asylum seeking as well. And then innovation in homelessness and rough sleeping, so anything around the transitional accommodation, pathway transformation, and the communities team work very hard on the kind of preventative model in terms of early homelessness, making sure that we are working with those with complex needs as well, rough sleeping, and then a prevention first approach, so working with the One West Northants plan and making sure we're working on safer, healthier, more resilient communities by proactive intervention through neighbourhood teams and the housing pathway and those with complex needs. Vicky, I'm going to let you go on to the stats bit if you want to move on. I don't think we want to go through all of this. There's an awful lot of figures in there that obviously the slides will be shared with you afterwards. So Ashley, can you move on one more? Yeah, okay, I'll let you work on that. Just pull out a few from there.
So there's loads. I'm definitely not going to go through it all because we'll be here all night. But I thought it would be really useful to see some of the different kind of function areas, some of the activity, the figures, and then also the community impact. So there is some case study stuff in here too, so that you can see the impact that some of the work that the teams are doing is having on individuals. So in terms of community safety, really good performance here. 3.9% reduction in overall crime, which is is fantastic. Another year with a reduction in violent crime, 4%. Violence with injury reduced by 8.1%. That kind of bucks the national trend. So when we're compared with other areas that are really similar to us, we're doing really well. And I think that is absolutely a result of the work that the Community Safety Partnership are doing. So a range of partners, how we're working with our communities, is having a huge impact. You can see there's other crime types there that are down, and I've included some figures around enforcement and disruption powers from our Untouched Behaviour and community safety teams. So really what we'd expect to see, so kind of, lots of warnings, which is that sort of like earlier kind of, intervention. And as you kind of go through, there's less criminal behaviour orders. There's quite a few closure orders on there. The team work really closely with the police, and there's some cuckooing injunctions on there too. Next slide, please, Ashley. So I think we've been before and spoken about local area partnerships. I don't think we probably need to go through that in any detail. I suppose just to say that the lapse, there is still work going on within the local area partnerships. The community development teams are working in the areas that have been identified. They need us the most, whilst we identify formally what our priorities are and what geographical spaces we're going to work in with those local area partnerships. So this is just an example of some of the work that team are doing. So a community-led regeneration project in Kings Heath, that's in Park Square. Lots of partner organisations, the community coming together, so around 50 residents and partners come in to clean up that space over a few days. You can see there's some planting, you can see the graffiti mural that's been done there. There was lots of other painting and engagement and cleaning up that were done that you can see on there. Everybody, I'm sure, knows about the wellbeing roadshows, so regularly visiting around West Northants, primarily in spaces where we don't have community spaces. So if we've got gaps in services that have identified, primarily that's where the roadshows will go. You can see 15 different providers offering a range of support around health, community safety, some of those kind of wider social determinants that we know about. 130 welcoming spaces across West Northamptonshire. You can see there over 7,000 people attending, nearly 3,000 signposted support organisations, a couple of case studies. I've got a wealth of case studies if anybody wants any more of those, but they really help with understanding what these spaces mean to the individuals that visit them. Next slide. You don't want me to say it, Ashley, do you? So you keep going really quick. Money and Wellbeing roadshows, so 17 events, 550 attendees, chatter cafes, again, some case studies. I've got lots of these, I've just put some snippets on the slide, but you can see the range of organisations that are engaged in those Money and Wellbeing roadshows. So great range of services getting out to our communities. Grants and volunteering community sector. So Jane said earlier, 2.2 million. That figure includes the next slide with our direct grants as well. So you can see the different grants and the amounts that we've given out, and then you can see the beneficiaries on the other side. So roughly how much money we've given out and how many people that has benefited.
Sorry, I was just going to add to that. We absolutely make a proactive point of where we can secure money from other grants that we're getting in to turn them into an investment in the voluntary and community sector as well. So the original grants pot that we started with in terms of what is in our base budget is much lower than this, but we work very hard to ensure there's additional investment in the voluntary and community sector as well, which is where some of that is coming from.
That's why. Sorry. So some direct grants around money and debt, local infrastructure, community transport, and again there's some figures, there's some stuff for you to look at afterwards, and then 3 case studies that we've picked out from a range of the grants that we provide. Again, I've got a wealth of those. We collect all of that information as part of the monitoring of the grants that we give out. Next slide, please. So resettlement and engagement. So again, just some figures in terms of the numbers that the team is supporting. I think that is the only corporate indicator that is reported on. So if I'd have come and just spoke about that one, it wouldn't have given you a true reflection around what the communities team do. So I thought I'd give you all of the slides. And then also, you know, engagement with town and parish councils. That's been a huge priority for us this year, as well as the vibrant programme of events that we've got that the team focus on and deliver with our community. Again, there's some case studies. So some specific case studies around individuals and families that the team have helped from Afghanistan and Ukraine. So again, you can have a look at those in your own time. Homeless prevention projects. I don't think you've got this yet, but we'll make sure. Yeah, it's sent out. No, you haven't got it. Good to be able to read it in detail. Do you want to do that?
Yeah, I was just going to say the welcoming homes is one really important one to draw your attention to. I mean, we did send these in, so I don't know if they're included as an appendix. Richard, you can confirm afterwards when they'll be sent out. But this is a really important one because it's taken the concept that we use with Homes for Ukraine, and Vicky's team have done a brilliant job on taking that concept of having host families and using it to solve some of the homelessness issues proactively. So it's worked particularly well where we've got someone like a care leaver, where they've got a potential environment with somebody there who can support them, but they've still got their independence through having their own room and having their own space, etc. So that's been a real innovation, and because it's been so successful, we're going to keep expanding that out as well.
Yeah, it's taken us a while, hasn't it? 2, 3, nearly 3. It's matching the sponsors with the individuals and making sure that is right. We're going to do a drive on it. We've done the pilot. We're going to do a further drive on it. We wanted to see how those have gone. They've gone really, really well. We've seen some huge success. So, yeah, as Jane said, it's really useful where somebody can offer that sort of like mentoring. Yeah.
Other councils have done it with matching a young person with an older person with needs. Yeah.
Yeah, absolutely. Okay, next slide, Ashley, please. Thanks. And then I know housing feeds into somewhere else, doesn't it? But rough sleeping's within my service. So I've included a slide around rough sleeping. In the last 12 months, we've seen a consistent reduction in rough sleeping, which is fantastic. The team have been doing some great work, of which I've listed up there. It includes the standing up of St John's House, that offer of transitional support, winter provision with the Hope Centre, and redesigning our pathway and supported accommodation. Oh, it's not the last slide. So I've just included some of our the focus for our priorities next year, really. So we've come to the end of the performance year, and we're looking ahead. Our service plans and our areas of focus for next year. So I've listed on there our 5 priorities, which kind of match what I've just presented, really, in terms of our approach and what Jay mentioned earlier.
Thank you.
Okay.
We've
got one more.
On to David, yes. I think giving everyone a real brain ache this evening, I think. Yes.
Chair, sorry, I'm a little confused because the agenda item was the adult social care monitoring performance, and you said we're going to have some additional stuff. I'm feeling absolutely bamboozled because there's some really great stuff that's being reported to us. And I think you're just about to say, how do we remember all these questions? I'm actually feeling, how do we remember what we've been... there's a lot of information that's being thrown at us, really good information, and I just don't feel that I'm adequately able to contribute much, to be quite honest with you, because there's an awful lot that's being thrown at us, which is...
Yes.
So I don't feel that we've really
I think
got
we need to hear David's thing. I think we then need to sort out how we just process all of this, because there is...
I just don't feel we'll be able to do it justice in the way that we've had it all suddenly presented to us.
I think that's right.
And obviously, we want to give it justice and give you some good feedback, and don't feel we're going to be able to do that.
Yeah. Well, shall we just get David to do his presentation, and that will that will give us the complete set of information. I think we then need to decide how we kind of drill into this, because I think some of this is kind of hard data, and some of it is areas that we might want to look at. So we'll David, do your bit, and then we'll...
Okay, we'll dive into it. So I'll talk you through them. They were written as a pack, as a report, so you'd have a chance to read them, and you can take these away afterwards, and I'm happy to take questions afterwards as well once you've had a chance to delve into it. I've focused on the 9 indicators that are on the corporate scorecard, plus one extra one just to give a bit of context around some of the children's data. I think, as Vicky said, if I was talking about the performance of public health overall, we could have spent 2 hours just talking about all the other things we do. This is the tip of the iceberg of the stuff that public health does. This first indicator is around infants due a new birth visit. It's related to our health visiting service, our 0 to 19 programme. I'll quickly summarise each one. You can see here that the performance has been decreasing on this, and there is a reason for that, in that nationally the target for health visiting services was changed to change the number of days after birth in which you achieve your new birth visit to 21 days. So this metric here will need to be updated as we move forward and refresh our corporate targets. So what we do see in our service is that 99.3% of newborn visits are completed, as you can see, albeit not within the 14 days that was originally done, but we continue to sort of meet that target. Some of the reason that those changes have happened and the positive side of that is that we're focused on the importance and the quality of those visits rather than just the speed of those visits. But also it gives us an opportunity to think about those other areas of the health visiting where actually we do need to do some improvement work and reach out to more families. And I'll come to those later. The 6 to 8 week review is performing well and remains steady and above where it's targeted at, and above does well in comparison to the national averages of 85%. So that's a really positive one to talk through. If we move on to the next one, this is not in the corporate scorecard, and it is sort of the reason why I just wanted to give some context in relation to the previous 2 metrics, which is something that I think going forward is important for us in public health to keep monitoring, is the performance of the 2.5 year review. It's an area where we've historically struggled in terms of engagement to get and increase the uptake of this visit. It's something that has been improving over the last year and a half, and we've seen important improvements in that metric, and we're now seeing almost every single family invited within the timescales that they would be expected to. What work now needs to go is understanding why those families who are choosing not to engage in that visit are making that choice, and how we can engage them in different ways to conduct that visit within a sort of timely manner. It's really important, this visit, in terms of those good levels of development and identifying for families and early years settings how we can support families between 2.5 years and starting school to see how they can improve. And I think this is a metric that we're particularly working with our provider on improving going forward. So we've moved forward. The final Children and Young People's metric is related to improving the outcomes of mental health and wellbeing in relation to the REACH service. So this is a collaborative of providers that provides counselling services to young people aged 11 to 19. offers support, information and signposting. It's funded by the NHS and both local authorities, North and West, and continues to perform well, but is again, the challenge with this one is a metric of public health performance. It's a metric of a particular collaborative system service. There is particular work to do as a system on this area going forward. It supports the CAMS service, the Children and Adolescent Mental Health Service, in terms of trying to reduce waiting lists and the number of referrals to that service. However, sustainability of this of the REACH programme going forward is a key system sort of question that still remains. So at the moment, both local authorities are committed to funding this for the next year. It's a service that would this constitute something that the public health grant funding should be spent on is something that needs to be resolved, and whether NHS is committed to continue to fund it, or what service will come in its place to support these families is not unknown at the moment.
Sure. I'm sorry, Chair. I just want to come in that microphone. Sorry, you're right. Just wanted to come in that very quickly, Chair. I know you said questions at the last minute, but I don't want to forget this. Some of the other sessions that we've been doing have been showing that some of those services for CAMS, the waiting list like 52 weeks. And on top of that, you mentioned here about therapeutic sessions for that particular age group. Now, you know, what does this service provide specialist services for those young people and probably, you know, young adults as well? And there's so many different types of therapy that's needed for different people. I know from some of the experiences that I've had is that, for example, if someone needs EMDR, the NHS or public health only have one person that specialises in that, and the waiting list is so long. So it would be a shame if this was cut, because from what we're seeing in terms of CAMS, they don't have the resources. This seems to be providing something that would you know, complement that. I don't know how effective it is, can't really see the stats around that, but actually, is there a conversation going on around the need? I know there's always the funding conversation going on, but the general need that's required, is that something that is assessed, or is it pretty much
there's definitely sort of a conversation about how we can support children, because mental health is a massive issue. CAMS is a NHS-funded service that I think, has it been to the Children's Scrutiny fairly recently? Yeah.
Very unsuccessfully, I would say.
Okay. And I think this service it offers therapeutic services, but at a much lower early intervention level. But it is a therapeutic service as opposed to what we're exploring at the moment, which is where public health might fund preventative action in terms of mental health and how we might allocate our funding towards that space. There's a lot of conversations that still need to happen in this work to identify that pathway.
Everyone's not connecting. It just feels that way.
Yeah, okay. The next metric that we've got here is the smoking quit rate at 4 weeks. So we know that smoking is still a sort of a key cause of premature mortality. In West Northamptonshire Council, we have an in-house stop smoking service that is funded by Public Health and situated within adult social care. What you can see is over a 50% success rate in terms of those participants engaging in the service quitting after 4 weeks, which is higher than that national target of 30%, but below where we want it to be in terms of a target of 60%. There's a lot of work that's happened over the last year to improve that figure, and in particular work continues to try and engage in the community and GP practices to increase the number of referrals into the stop smoking service.
Sorry, one clarification.
Yeah.
When you say quit smoking, does that include vaping as well, or is that just cigarettes?
So it is just cigarettes.
Okay, is there a separate one on vaping?
We don't have a stop vaping service or a stop vaping metric.
That's so surprising. I mean, it's such a big issue across so many different ages.
That was what it was supposed to be.
So,
okay, let's stick to David's presentation.
I'll quickly just answer that one. So the stop smoking service So vaping is a interesting question, a complex one in two sides of it. Vaping is significantly less harmful than smoking. Therefore, it is used as a quit aid by our Stop Smoking service to help people come off smoking cigarettes. But I agree with you that there is increasing issue and discussion around children and people and young people about that increasing nature of vaping. In certain circumstances, yes, to reduce there is a harm reduction approach to reduce the amount of harm that they're doing, and providing them support then to wean off nicotine so that they are then able to more likely to quit overall. So moving into people in weight management services that lose 5% of their weight. This is a standard metric that's used nationally, and the service is performing above where you would see potentially a national target of 30% of people completing a programme achieving a weight loss of 5%. So the service is overachieving against its target, but in terms of, again, similar to the Stop Smoking service, the number of referrals coming into the service is below where we'd like it to be. So much of our focus with the service has been on how do we increase the number of referrals into the service so that we are seeing more people achieving this success rate. We carry on through. We move into two metrics that are related to our drugs and alcohol service, one on opiates and one on alcohol. I think the thing to note with these two services is that these are figures from a service that has just finished, a legacy service as we would call it. We have a new service that started on the 1st of April this month called Inspire. That is a new provider coming into this space and will be responsible for this treatment going forwards. The metric that you've got in front of you achieves above the national average and has been a successful completion of adult drug treatments above that national average figure for a long period of time. If we move forward to the next metric, one area that the new service will particularly focus on improving is looking at the successful completion of adult alcohol treatment. It's below where we would like it to be nationally. This is obviously an old service. We've got a new service coming in with a new provider, and so they will be taking their own approach to how they look at this, but we've taken the learning through our commissioning team from that previous service into the service so that we continue to build on the foundations that we'd already started with trying to improve this figure. I'll skip through to the next one then, and NHS health checks. NHS health checks are a programme for adults aged 40 to 74 in England without long-term conditions and trying to identify some of those early signs of heart disease, diabetes, etc. We commission our GPs. There are 38 GP practices across West Northamptonshire who participate. That's all of the GP practices. And there are 4 alternative providers, including some of the sports charities who support us in delivering health checks across West Northamptonshire. The figure of 8.8% is just for the quarter. It equates to just over 2,000 people, which is a much easier figure to sort of think about it rather than 8%, because the 8% is calculated based on the proportion of the number of eligible people who are invited and accept their health check. What I would say, I suppose, just on that health checks is that I think it's an area of some really innovative work. There is some great outreach work that's been done in community clinics and in workplaces, but also a really novel approach to thinking about how we support those GP practices who struggle with capacity to conduct health checks, and think about how we use inter-practice referrals between GP practices and pharmacies to make sure that we're continually looking to increase uptake. And what we have seen over the last few years is actually increases in the uptake of our NHS health checks, which is a great achievement compared to sort of some of the trends we're seeing nationally. final metric is the rate of emergency department attendances for falls in those aged 65 plus. I think the point that I will make about this one is that again, it's one of those metrics that isn't necessarily a metric of public health performance. We have historically seen in West Northamptonshire a higher number of people 65 plus admitted to hospital following a fall, but that is no longer the case. We are now in line with the sort of national averages. But it relies on a system response rather than the actions of just public health or one organisation. I'll summarise some of the actions that we've taken, but it is a system response that requires NHS partners and local authority to working together. Public health funds a series of strength-based exercise classes in the community. We have 33 get up and go sessions every week that people can take part in. We have awareness campaigns, and particularly focusing around that whole healthy ageing agenda as we go forwards. And something that's not noted on the slides actually is that we also fund a falls management service, which is now sits within adult social care, and that receives between 100 and 160 referrals each month, and conducts around 40 to 80 assessments each month to support individuals who've experienced a fall. So lots of work happening on that area, and some positive signs in terms of reduction overall, but a metric of system performance rather than just public health performance. That is a whistle-stop tour through some of the performance indicators in the corporate plan.
Right. So I'm sure. I think we've got two issues to deal with here. I think one is particular questions about particular bits of the presentations, although there has been so much there that we could well be here till midnight to look at that. But I think the second issue is just, as a committee, just how we manage this going forward, because we've been given kind of too much in one go for it to be easily digestible, and we need to be able to, perhaps for the future committee's work, kind of maybe have a better forward plan. We might not need every bit of that to come to every meeting, but it might be that we could space it through the year, and I think I need to kind of, any ideas from committee members would be very welcome on that.
Cabinet member.
Yeah. Laura, do you want to come in?
Sorry to come in like this. I think it might be a good idea, bearing in mind it's nearly 8 o'clock. I don't know if the gates will shut us in or not, but there's an opportunity where if we've got questions it's going to take too long, perhaps all the questions could be directed to you and then passed on to us to respond to, and then it keeps it in scrutiny. Is that a possibility?
Right, that's one suggestion. Shall I go to Andrew first, and then Adrian?
Building on the point, what I'm really worried about is that these reports go to Cabinet and it says they've been passed overview and scrutiny. We haven't done any overview or scrutiny of this because we've got far too much information being presented to us in one night, and that information didn't come. Some of that information didn't come prior. The bit that did was that item 7, where we did have a report, which we have been able to read. And that's what I was coming here prepared to question.
Yes.
I mean, I just hope we're not being expected as a committee to rubber stamp these reports to go to Cabinet because, or even be said that we've been consulted on it because there's far too much information and really good stuff. I don't want to get away from it, you know. I'd like to spend a bit more time getting under the skin of each of these things and being able to scrutinise them properly. But we're not going to have time tonight to do that, Chair, so...
Would it be helpful for Mel to come in?
Yes, so just to give a couple of assurances. So the reason for the presentation today was wrap up the year, not to scrutinise the performance. That was the request that was made in the pre-agenda meeting. I do acknowledge that some of the presentations we sent out, there was a bit of lost in translation about what we asked colleagues to send out, and I do apologise for that. We'll make sure that next time we all meet and we're really clear about that. Partly that was because of, I think, overlapping leave and other areas. The Cabinet report is a performance report that Cabinet sees. It doesn't give assurance it's been through scrutiny. So as a council, the council has moved from a process where all of the performance went to resources committee to, in future, for the next financial year, it will be going to these committees. Adult social care performance has come because I brought the report, but the cabinet report hadn't, which is why Councillor Purser and I agreed that we wanted to join that loop up and be ready for next year. The intention was to have a look at the areas for your work programme, not to scrutinise the performance or any expectation that we were setting that up. Thing about not scrutinising it, but actually I think what it does is it provides that level of reassurance that if there is anything that a wider range of cross-party councillors pick up, we can discuss it and highlight it ahead. So it's not about us scrutinising every little bit, but I think this is like a safeguarding, almost like we're public facing. We need to understand what's in these reports so that we can be accountable to the people that have elected us in, really.
I wasn't precluding that. I suggested that what we're asking is it's things you want to come back and look at in greater detail from that report, not that we wouldn't scrutinise.
Because you mentioned, you said that they're not here to be scrutinised tonight in terms of the reports. You did say that.
I think there's a misunderstanding, but yeah.
Councillor Cartwright, and then...
Thank you, Chair. I had an observation and a question. The smoking and vaping thing, I seem to know many filthy smokers, and I'm not sure how secure this data is, because no end of them say, I've stopped smoking, I'm on this vape now, and then 5 minutes later they're smoking and vaping. It's just an observation that I know comes, I don't know how honest they're necessarily being with the people that have got them on there. I'd like to go right back to the start of that, if I may, please, Chair. They used to get, if I cast my mind back all the way, you used to get a heel prick test at 3 days. Somehow that seems to have gone for a week, and now we have a 2-week newborn visit, and it's just gone to 3-week newborn visit. I'm not sure why that's happened, but I like the idea of the heel prick test at 3 days, because people that have issues with the newborn babies need to get that information found out at the earliest possibility, not 21 days later, plus testing time. So that is an issue I know from personal experience. Thanks.
So I'll just come back on both. I'll do them in reverse. So the heel prick is not conducted by the health visiting team. That'll be conducted by the midwifery team and NHS, and therefore is a separate programme, and it will be done separately to this visit at a different NHS visit. So it's oh, sorry. So that would be that's a different team and a different approach to that one. From the smoking and vaping perspective, I suppose it's just reassurance that those smoking figures are based on what we call the carbon monoxide monitoring. So we do CO monitoring to assess objectively someone's quit from smoking. So it's not just based on self-report, but I do acknowledge your point in that vaping is an increasing issue for us to consider and think about.
Thank you, Chair. I've got 3 questions, all directed at David. But I'm a little confused. I know Councillor Cartwright has asked his question, but do you want us to put the questions to you, Laura? Or can we ask them here? Sorry, I was a bit confused. We can ask them. Okay. Right. The first question is about Inspire, the new drugs and alcohol misuse service. I think I read that it was solely for Northamptonshire. Was that right? It's not a national organisation?
So it's a service that's commissioned by this local authority.
Yes.
For just West Northamptonshire.
Right. Okay. So basically, because they're having some new approaches, have their approaches been benchmarked against other successful local authorities?
So the new fighter started this month, and they went through a competitive tender approach to be awarded that contract. They're collaborative, so it'll involve a number of different organisations that will work together to provide the service, and they will be using obviously evidence-based approaches that are used by providers across the country, and these providers also provide similar drugs and alcohol services in other parts of the country as well.
Thank you. Can I say my other two questions, Chair? Thank you. All directed at David. Second question then is to do with the inter-practice referrals. And it's really the accessibility. You know, if we're expecting our residents to be going to different surgeries or different pharmacies, you know, in terms of transport and costs and time, how are we sort of mitigating those? Thank you.
Yeah, so the inter-practice referral is an initiative set up to sort of, I suppose, increase some of the availability, because some of those individuals won't have access to the opportunity to have a health check at all without it, because their own GP practice might not be conducting health checks. What we have done to try and increase that accessibility, though, is to not have it solely based on GP practices and the requirement to go to GP practices. We have 4 alternative providers who provide support in the communities, and we have a number of outreach community sessions, pop-up clinics that we run, as well as sort of going into workplaces to do wellbeing checks and vaccination offers at the same time.
Thank you. Third one is probably a little bit more simpler, and that's only to do with the healthy ageing. You said there's 160 referrals. Basically, what emphasis do we place on exercise? Because you know that with balanced exercise, that can hugely stop people from falling. Obviously, people have got to engage in it, though.
Yeah, so the falls, so the falls management service, which is when someone's had a fall, that's the number of referrals that service is receiving, and how it is providing support to those individuals. Public Health also funds a number of functional exercise classes in the communities that allows older adults to engage in some of that physical activity and try to reduce their risk of falls. So there are functional exercise classes that are available in the community.
Right. Thank you. Yeah, Chair. So, well, I was going to just say we're getting into some detailed questioning of the aspects of these reports, and I don't think that was what we were intending to do. And I think Melanie had described that it was giving us a flavour of these areas, and that we should be deciding how we take those forward into our future work programme rather than getting... Because, I mean, we can all ask lots of questions on the reports we've had tonight. And I just think that it's not going to be very constructive if we jump around from one report to another. And we might be better to just say, you know, what we've seen tonight, what are we going to focus on next in more detail?
Yes. I mean, I think...
You know, I mean, health would be one that I would say we'd want to do that.
I understand what Council's saying, but at the same time, I feel that there are some... Sorry, I keep doing that. I feel that there are some questions that do need to be asked, because I know they won't be asked again. And now that we've got this opportunity, I would like to grab it, if that's okay. But I understand it won't be a full, thorough questioning in those terms.
And can I just say to Councillor Simpson, we will be looking at the work programme as the next item on the agenda. And I think we've got a suggestion about how we move forward for that. So I think let's just deal with some sort of final questions on the reports that we've had, and then we can move on and look at the work programme. And yes. Councillor Herring, sorry.
Actually, I mean, voicing it again, if this was just for information and we weren't meant to be doing asking any questions or interrogating it or scrutinising it, it could have just all been posted in advance, and then we would have at least had a chance to read it all. I wanted to ask about the falls information and how you collect the data.
So the falls information is the rate of emergency department attendances. So it's based on hospital episode statistics, which is a database that the hospitals record.
And are you checking all the surrounding hospitals, or is it just Northampton?
It's a good question. I have to go away and find out where the data
because all of my constituents, they'd all be going to the Horton or the JR, and then there's a whole portion of patients who'd be going to Milton Keynes, and also my experience of the falls prevention service with my father was he was assessed by OT and suggested that he needed falls prevention. When I tried to get him referred to the falls prevention, they wouldn't see him because he hadn't had a fall. So how can you prevent it when you haven't had a fall? Yes, it was all just a bit
Yeah, no, happy to take that away as well and outside and have a discussion about some of those opportunities and pathways into it. What we are doing between public health and adult social care is setting up that prevention and early intervention programme that we have. I think prevention has come here in the past around adult social care, and really looking at those falls pathways. There's a workshop next month for the bringing in NHS partners, voluntary sector and local authorities together to discuss that entire falls pathway and where those opportunities for prevention could be.
And particularly I think it's a really good idea. I'd seen a lot of data about older people doing Tai Chi and it being very strengthening. But then we've got all these villages and all these village halls and a very ageing population, and they're not reaching them. And so I'd like to see maybe through the voluntary sector that we could do more to actually get into the smaller communities, because we've got a very ageing population. Anyway, I think there's quite a lot I'd like to say about all the babies and the young, but that could more appropriately go to the children's one as a work programme, so that's fine. And I wanted to ask Vicky on her side, the one thing that I felt was missing in yours was drugs and drug-related crime, and particularly it's no good as saying crime has fallen by X or violent crime has fallen when we've got young people who are being stabbed to death outside schools, and most of it is actually drug related as well and drug issues, and we really want to see more action from the police. I would like to see police being around a secondary school when they come out of secondary school at least once a week, so that they know that there's possibly somebody going to be around. And I think that will significantly interrupt the county lines and the drug service. I heard some research from London that they said if they had visits within a week, different days, it was enough to actually deter it for the whole week, because they were too worried to think that they might get caught. And anything more than a week, they became complacent. And I've tried loads of times to actually get that. We've got a real problem in Middleton Cheney. So, you know, it's the villages as well. It's the smaller areas, and we've got a real problem in Middleton Cheney, and it's particularly a problem because of the motorways. They can be in and out and back on the M40, you know, in the blink of an eye. And it's the same at the top end with the M1. So I didn't see it, and I'd like to see something about that. Thank you.
Am I on? It is in there. I rushed through it really quickly, didn't I? So there was some on the beginning. It isn't all in there, Rosie. I'll be really honest, because there is a lot going on, and I just wonder if you're looking at the work programme whether it's something for the future, because there's also something around kind of it's exploitation, isn't it? So it doesn't specifically say drugs, but there's a lot in there around CCE, and that spans across some services. So we work really closely with education and the trust around and the police. But it is a multi-agency approach, isn't it? Some of this stuff, and there are specific initiatives, some of which is mentioned in there, some of which isn't. But I am more than happy to either come back to a future session or do a briefing, which just kind of outlines and details some of the specific stuff and go into a bit more detail than what was on the slide.
I'd really like that, because it seems to be muddled as to how we actually deal with drugs. Drugs, it seems to be okay if you're smoking in your house, but you know, dealing is not allowed. You know, and people are very confused about what they can report and what they don't. I mean, we get reports from people, constituents, where they cut their overwhelmed with the smell of cannabis coming out of residences, but that's not, the police don't want to know.
My advice would be to report that to the police, to report anything to the police. If you feel that it's a crime, if you feel there's a threat or a danger, I would encourage anybody to report to the police, and if not via 101, then online. It's really simple to do online because it's all intelligence as well. So even if it's not a crime and the police won't come out to it, but it's still intelligence, isn't it?
Right,
so I would
just
report
a moment. I've got a list of people. So I want to go to Scott first.
Thank you, Chair. I just wanted to reiterate Rosie's point here. This is overall crime has gone down 3.9%, but this is just reported crime, and especially in wards like mine, people just aren't bothering anymore to report it. They feel that nothing's ever going to change, nothing happens, the police don't come out. It's basically legitimising lower level crime when, and then we say to each other, you know, there's a reduction of 3.9%. It isn't. It's just people aren't reporting it anymore. I go around and you can see drug paraphernalia being used. It's just discarded on the street. It's not even being covered up. People just aren't bothered anymore about pretending it's happening. So we appreciate that you might think that there's a reduction, but there isn't. And that's just the lived reality, really. So.
Thank you, Chair. I just want to come in there as well. Something that's happened in my ward is obviously just echoing residents' concerns that, you know, the police will often say, get out your phone and record it, but neighbours don't want to get out their phone and record anything because drug dealers and people, you know, doing this will know where they live, known in their communities. It stems both ways. So, and there's a real fear of the lack of trust and lack of will I be grassed up. But I do know there obviously is Crime Stoppers where it can be reported anonymous. So there's that side to balance it as well.
Okay, right. Mel,
would it be useful, Chair, to add to the work programme a look at our approach to supporting substance use? Would that be a useful forward plan?
I think that would be would be useful. I think that there is also an issue about how councillors deal with crime in their local wards, actually, and whether that is done through scrutiny or through a briefing. Certainly, we've had experience in our ward of working really quite hard with the police about how do we as councillors report, and then how do residents report, so that actually incidents are reported, you know, as they happen, and more serious incidents we escalate. And so I think there is something about how can we be effective councillors in our wards in dealing with sometimes low-level crime, but actually sometimes higher-level crime that we might come across. So I think that is something we might well...
Just sorry to jump in, but could I'd support that as a future work item, because I think I'd mentioned it at a previous report that you'd done. Again, experience in my patch with the Ibis Hotel and the migrants' house there, that there was a lot of sort of rumour monger going around, and we were saying to people, look, if you see something, report it to the police, because then that builds up the intelligence of what's happening in the area. But there wasn't any feedback given to people about that, and even us as ward councillors. So whilst we were going out saying, you know, if you've seen something, report it to the police, there's no feedback given, and there's no... So I think part of that review would be really good in making sure we're getting that feedback in and know the right channels to get this.
And I think this feedback loop from the police back to the community is an important one, which I think we're still struggling to get right. Now, time is going on. Yes.
I'm not going to ask all the questions. I had loads, but there are a few pertinent ones that I could want to ask. Look, drugs has been mentioned a lot. Very quickly, since we've got the Chair of Children's here, whether we could add the county lines issue onto children's scrutiny, if that's something that you could pick up. That's my first one. Secondly, I know we're talking about cannabis addiction here, but we've also spoken about mental health as well. And we spoke about waiting times and so on. one of the patterns that seems to be emerging is people are self-medicating if they're not getting the support they need with mental health. So I think there's this wider issue as well, where I'm not just saying that people are just smoking cannabis to self-medicate. Obviously, there is a choice there as well that people are smoking. What I'm trying to say is, again, it's that joint up. We've got a wider issue, people not getting the support they need, so they're turning to other methods, basically. That's one thing. Number two, it was a question about Inspire. Now, are we looking at cannabis addiction as well, or is it mainly focused on ketamine and cocaine addiction? Because it seems to me, I've had a parent that came up to me who had an issue with their young adult being, addicted to cannabis, but there's no services that help people get off cannabis, because the answer they're getting is that it's a psychological addiction and not a physical one, which again completely baffles me. If we are putting these services out, actually they should be helping people get off the most common drug that's being used, which is cannabis. So that's one question on that. And the other one was, there was a question on NHS health checks and reminders around that. I didn't see anything on smear test, breast cancer, or prostate cancer checks, and when they are put out. On that report that you said they probably are put out. And very quickly, Vicky, have you heard of Good Companions? It's a voluntary organisation that's helping a lot of seniors with loneliness and so on. I think that's someone you should reach out to. I'll give you the contacts for them if you've not already, but they have 100+ seniors that get together and they're doing such a fantastic role, but I think they could do with some funding. Okay, and then community transport was my other question. Obviously, with Ability Bus, you mentioned community transport, and we spoke about the ageing population in some of our villages, in my area as well, in Northampton. How are we looking at tackling some of the issues that have come around that? I know there's quite a few bits that I've thrown out there, but you did throw a lot at us as well. Thank you.
I'll start. It might be worth the Inspire service coming to that session on the drugs and alcohol as a sort of a wraparound. There is two parts to the new Inspire service. There's the Inspire service, which is for adults, and Inspire Youth, which is for children and young people experiencing substance use issues. I would encourage anyone, including parents who are concerned about cannabis use in their children, to contact Inspire and have that conversation.
Can we have the details as well so we can pass them on to any parents or adults?
Yeah.
Thank you.
Health checks question. The reason that you didn't see all those other things is because health checks are something that are commissioned by and paid for by Public Health. It may be called NHS Health Checks, but it's funded by Public Health and Local Authority. Those other screening programmes that you talk about are NHS screening programmes. And I think if we're looking to go down and scrutinise some of those, then it would be about inviting NHS colleagues, NHS England, to come and support. Those are, however, national programmes, and it would be then about local performance related to those, because they are all sort of nationally run schemes.
Thank you.
Right. I think I'm going to draw a line here, because I think it does link with the future work programme, and I think I'm going to ask Richard just to talk about where we are in terms of the future work programme.
Thank you, Chair. We're at the end of our current work programme, so we need to set about determining our work programme for next year. We have annual council on the 21st. There is a free date on Tuesday, the 26th of May, for this committee to hold a work programming event session. That could either be here in person or online via Microsoft Teams. That would be for the committee to determine. But if everybody is happy with that date, we can pencil it into the diary. And some of these ideas that we've had battered around, we've already got a few bits for June's meeting, I think. But for the wider work programme for the next 12, possibly 18 months, we've spoken as officers about taking a longer term horizon scanning view on this. So hold on to these ideas, and I'll put it back to you, Chair, if everybody's happy with the 26th of May for a work programming session.
Mel, come in.
I wanted to close the loop on performance reporting, if I might, and make a suggestion. So just to reassure you, we have looked at adult social care performance every quarter over the last time since I've been here, and I would suggest that given our requires improvement rating, we'd continue to do that, and that the performance report includes and performance against targets, the care quality aspects that I know committee's been really interested in. So really pleased to hear the report from Ashley, but also to pick up some of the case studies in the way that Vicky's presented. And then maybe as part of the work programming, in between those adult social care performance monitorings, I want to consider how frequently we get a performance report from communities and public health would be my recommendation to committee.
Thank you. So, and Richard, I'm right in saying actually we've got a full agenda for June already, just so the committee is aware of what we've got penciled in. No, I think actually firmer than penciled in.
Yes, Chair. I think we're due to have a suicide prevention strategy, but it wasn't ready for this meeting, so I think that'll be June. There was something about a Dole's paper as well. Is that correct, Melanie? Or not? No?
Not to my knowledge, no. We did an off-agenda briefing on the Dole's performance as requested.
Okay, that's fine. Thank you very much. And an ICB visit as well.
Yes, so I think a visit from the ICB partners. So but perhaps we just need to clarify what we're asking from them for that. So
if people can have a think about that between now and the 26th of May, we can narrow that down.
Yeah.
I'd just say I'd be interested to understand how the ICB and the LAPs are working together as part of that, because having attended the 2 meetings of our LAP, I'm still not very clear on that. So it would be good to see how that works.
Right. Councillor Herring.
I just wanted to say something to Ashley, and I think I missed it from the report from the first. When I came in late, I'm sorry about that. And it was about your commissioning, or just about to commission equipment. And it prompted me to say that could you count in when you're doing that commissioning or consider the removal of the equipment. Had a constituent who had nursed her husband down in the downstairs sitting room until he died, but I think it took weeks. She had to literally walk past that bed and all the equipment after his body had been removed, and it took ages to get all the equipment removed. So I thought, whilst you're commissioning, just make sure you put in something about the removal of equipment as well. Thank you.
That's no problem. It's actually part of the current contract is that the equipment should be removed, but I will have a look at that case. I'll perhaps have a conversation with you outside that meeting, and I'll look at it individually for you. Yeah.
Right, so 26th of May, is that assuming people are renominated to this scrutiny group, is that a good date for people? Looks like it, in that nobody's waving at me to say it isn't. Would people prefer that to be an in-person meeting or an online meeting? We did it as an online meeting at the end of the summer, but very happy for it to be in person if that's going to be better.
Can I ask it to be online?
People happy for it to be online? Yeah. Yes. Yeah. Yeah. Right. Yes. Good. So that's. Can I thank the officers for their presentations and for the information that is going to be circulated to us. I think it's probably worth us actually going through that pretty carefully. If we've got queries coming back to officers, you know, but also to be thinking about what are the areas we want to look at in terms of scrutiny. What are the questions it raises in terms of future scrutiny? So that's the challenge. That's your homework to come to that meeting prepared with what you think the priorities are for scrutiny. And can I thank you for your patience this evening? We've covered an awful lot of ground. Some of it too thinly, but there we are. That's the life of a scrutiny committee. So thank you very much for the officers. Thank you to members for your attendance this evening. And just to thank you all, this is the formal last meeting of this committee in this municipal year. So thank you to members for your input to this committee over the year, which I hope is reflected in our annual report to council. And thank you to Democratic Services for keeping us to some extent in order. Thank you.
Well chaired.
Right.
Thank you.
Well
Together. Well done.